Hello, everybody. Welcome. It's a privilege to be a speaker at the Academy of Oncology Nurse and Patient Navigators virtual conference. I know the world has changed a little bit, but as you know, our work doesn't stop, and so it's a privilege and honor. Now, I've been instructed to stay right in this place, but that doesn't mean you have to. So please feel free to stand up during this talk. I mean, we are talking about functional medicine approaches in oncology. So often we do things from a seated position, but that's just because sometimes that's what we're accustomed to do. So feel free to invite your state of presence, shake it out, and let's enjoy this ride together. And again, we're going to give a little overview. We're going to go through the outline of what we mean by functional medicine in oncology, the challenges, the references, of course, which everyone's interested in, of course, and then finally the quality of life and beyond of our patients and also the providers. And I want to make sure that's very clear because it does go both ways. And finally, taking a different potential look at cancer and oncology. And that's why it says at the bottom right, let cancer heal you. Sort of an oxymoron, if you will, but that's kind of the general attitude in which we're going to proceed forward. I am a radiation oncologist in Miami, and my name is Niraj Mehta or Raj. I'm also a choreographer. I run a movement and music program for people with chronic illness. And so that's sort of been my contribution. And it's been a privilege to learn from you guys a lot in terms of what we feel is important for our patient care and provider care moving forward into the next century. And I'm sure that a lot of this past year's event of 2020 has really helped frame that. So we'll move forward. All right, and I have no disclosures. There's no strings attached, and I just want to be sensitive to everybody. I always have that picture at the bottom right with the elephant, right? Sometimes we tend to have opinions on the way things are, and that's probably correct in a certain ways because they're opinions, but a lot of this depends on our point of view, right? Depends on what we're looking at. It's a tree, it's a snake, it's a spear, and I'm sure the healthcare providers, from the physicians to the front desk, to the administration, everyone has a different sort of point of view on these matters. And so I wanted to keep that sensitivity in mind as we move forward. I mean, these are exciting times, obviously, right? We talk about everything you read in oncology is about new technology, minimally invasive surgical procedures, interventional radiology, immunotherapy, right? I mean, there's certain people who get really excited about that. With radiation oncology, we have stereotactic radiation where we can sort of pinpoint certain tumors and also preserve normal tissues. And also overall quality of life, right? But what about the consumer end? How do they feel about that? And how are we sort of owning up to those goals, if you will? So today's talk is going to be divided into our objectives, basically, are going to be the definitions of functional medicine, the general approach, the active opportunities, what are the findings, what have we learned so far, the available resources, of course, which is going to be the key for us, right? And the limitations of scope. And I cite the limitations only to help demonstrate how we can definitely overcome them. And finally, I always have a quote here from Mahatma Gandhi. We have to be the change we want to see in the world, in a sense of not just by our opinions, but what we do, going from values to virtues. And not all of that has to be done within the context of our quote unquote work life. And the top screen is just kind of a little symbol of functional medicine with sleep, fitness, restoration, and movement. Again, a quote from Herbert Spencer we like to start with: how often misused words generate misleading thoughts. I think that's very relevant as we move forward today, even with talks about the virus. I think a lot of times we say certain things and that generates a whole thought process, and it's hard for us to sort of communicate effectively. So let's move through these definitions a little bit. Let's just call conventional medicine everything that we do in terms of antibiotic treatment, the state-of-the-art treatments in oncology with surgical oncology, medical oncology, radiation oncology, all those things. It's not just conventional in a sense of, that this isn't spectacular. It is marvelous, but we will call that conventional medicine. Complementary medicine is exactly what it's meant to say. Complementary techniques that are evidence-based, that have a role in the management of oncology to achieve certain endpoints. And it's up to us to define what those endpoints are. I think alternative medicine is a word that's bandied out about, and really alternative is what it is. It's an either or approach, right? And so we're sort of moving away from those teams, if you will, either or, and we like to say, how do we integrate these things? Now, I'd really like to spend a couple of minutes on holistic medicine. The word holistic often gets misused with natural or naturopathic. Holistic simply means treating the person or patient as a whole. And what do we mean by whole? The physical, emotional, mental, spiritual, and relational, systemic. Well, that's holistic medicine. That's all it is. It doesn't indicate that we're going to do one thing or the other. It just means approaching it from that angle. Okay. I think natural medicine, what we refer to that as herbal medicine, homeopathy, that's had a role in symptom management for quite some time. So it's always interesting to look at what that science has been. And finally, integrative medicine is really integrating the systems of wellness, right? Integrating what we can learn from the Hawaiian techniques, the Ayurvedic techniques, the Chinese techniques, the Western techniques, if you will, right? So this is about integrating systems of wellness to achieve our endpoint, and we'll kind of get it. And finally, functional medicine, which is something that's really grown over the time, is really a systems-based approach, looking at systems and body processes as opposed to the heart, the lung, the bones, and we've known that in cancer now, right? We've seen sort of this whole idea of a breast cancer change. Like, okay, well, what are we talking about? What's the hormonal positivity? So now we're looking more at biology a little bit more. In the same way, we have to look at the body as this complex biological process of integrated systems. And so this is a nice little matrix just for anyone to understand. You can show this to a physician, and it really kind of makes sense. And you can show this to some people that have difficulties really understanding what we're talking about, right? So right in the middle, you have the mental, emotional, and spiritual. The mental talks on cognitive function, the emotional about our own emotions, spiritual about meaning and purpose. Yep, all these things as they pertain to us. And then finally, the 6 or 7 processes that are happening. So away from organs, but rather defense and repair, energy, biotransformation and elimination, right? There's multiple organs involved in that. Transport, communication, structural integrity, and assimilation. I think communication is key from the point of us giving this communication through the talks, but as well as a complex array of neurotransmitters that are emitted and the responses at the cellular level. And then finally, on the y-axis, you can see retelling the patient's stories. What are the events before? What are the triggering events? What are the mediators and perpetuators? And then what we really always try to focus on is the modifiable personal lifestyle factors. And we'll spend the majority of the talk going through those: sleep and relaxation, exercise and movement, nutrition, the complex multidimensional word that's often grouped together as stress, and relationships. More definitions. So here's what we wanted to say about holistic and integrative. This is what we're talking about, right? So holistic is on the y-axis: physical, emotional, mental, systemic, and spiritual. By systemic, I mean relational, your life, the life at home, family, all these other relationships, maybe relationships even within the hospital network or the individual clinic network, which all of us can, of course, touch deeply with. And then on the x-axis, you really have the systems of integration. You have Western, right? So certain mainstream Western techniques really affect us at the spiritual, systemic, mental, emotional, physical. But now that gives us an idea of really saying, oh, okay, well, it seems like the emotional part of this patient is kind of missing. Which system can we help to engage with that, right? So there's really no contradiction here. Clearly, we know that in terms of the emotional and mental, for instance, with the yoga and Ayurvedic philosophy, this can really help an individual person at that level. And so that's really what we're talking about. With Chinese, you have traditional Chinese medicine, Qigong, which of course has come up, and mind-body techniques. And then finally, energy, which is more Reiki, constellation. And it's undeniable because this is very personal to us. It's personal to the patients, what helps them and what potentially can really help. And really the goal is to thrive, right? We talk a lot about survivorship, and I think that's great. I like the word thrivership. We want to create cancer thrivers and people that have really been able to overcome their journey. Obviously, the time length of that journey, we all don't know, but we can thrive while we're there. Where do we start? Okay, let's talk about the one that we all like to talk about, right? The physical, the diet and nutrition, right? So we have the inflammatory diet, right? That's something we talk about. You got the environment and chemicals that are being thrown at us, right? You got typical things we look at, alcohol and smoking and drugs. You got insulin resistance, right? We have chronic stress, which we'll talk about, lack of movement, chronic infections, inadequate sleep, right? And all these things that are happening. So that's really the kind of general mainframe. So now let's get, and I'm going to flash back to this slide just so we have some context of organization. Right at the bottom part of the screen, you can see we'll first talk about exercise and movement. And I really emphasize movement because when we use the word exercise, it's often poorly understood. We often think that it's something separate that needs to be done, which can be a possibility, but there's possibilities of integration as well. And so the first slide, of course, is pretty self-explanatory, right? Somewhere something went terribly wrong. And all this research on body postures, sitting, right? We talk about, hey, you know, we treated this patient, but why aren't they responding? And next thing you know, we see that they're sitting 10 hours out of the day. So what's the big deal? What's the evidence about sitting? So obviously we know the saying of Hippocrates, walking is man's best medicine. But guess what? We got some science on this. Daily movement literally adds years to patients' lives. And so they've actually went ahead and identified this, that sitting can actually be an excessive lethal activity. There was an article that was done in Australia that showed that each additional hour of television can translate to an 11% increase in all-cause mortality. Now, I'm not talking about television in and of itself, but it's a metaphor for sitting type activities. And that's really what's happening here. And that's fascinating that even sitting can become the new smoking. And I take that dearly to my heart because as a radiation oncologist, I'm often sitting when I'm doing a lot of the things. And obviously that's not part of my nature, but that's just the way it is in that sense. So how can we modify those things? And I mean, I think there's a whole host of activities we all know about high intensity interval activities, more simple type mind-body energies that are energetic transformational processes that anyone can do, yoga, bar method, even running outside, playing outside with the kids. And of course, the outside is poignant at the moment because of the way the world is right now. There's dancing, all kinds of things that we do that don't involve sitting in that sense. So I think that we are very, very familiar with, and these things are dear to our heart. What actually makes a person want to move? So proof, what is a proof? And I think that's an important part of the talk to spend some time on, although there's so much evidence in that sense. This is a nice article from the JAMA that showed a difference between breast cancer survivors who exercised or moved more than 3 hours per week versus less than 1 hour per week. And indeed, there was a 26 to 40% lower risk of breast cancer recurrence and dying from breast cancer. So that's pretty powerful when we talk about physical activity and survival. Yet how much time do we have, not just to tell a patient what to do, but really understand and engage with what are the challenges and barriers potentially that prevent such activities from happening. Of course, you're always safe to cite the disease prevention and health promotion about how many minutes per week of moderate intensity, vigorous intensity. We can always state those things, but do those things actually elicit change in and of itself? Physical activity is a public health problem. It's the fourth leading risk factor for global mortality. I mean, that's pretty intense. After hypertension, tobacco, hyperglycemia, you got a whole millions and millions of deaths attributed to insufficient activity. We're going to talk a lot about potential deaths caused by the coronavirus, but let's talk about potentially what can happen as a result of physical inactivity. It's obviously a greater risk for obesity and things like that, the physical aspects of it, but movement in and of itself saves lives, regardless of your BMI. And the statistics are shocking. In 2008, 31% of adults greater than 15 years were deemed insufficiently active. That's one of three. And sometimes it's sort of dear to our hearts because sometimes we're like, wait, how much am I sitting? And what are the challenges that I can do for myself, right? And this is just some other statistics talking about where, obviously in America, our sitting problems are a little bit more than in other places just because of the way we live our lives. And it's just a kind of a result of what happened. So we have to adapt and adjust, I think, or we should, or we could. So now I'm going to move to, so that's just a little bit on exercise and movement. Now I'll move to a second modifiable personal risk factor is sleep and relaxation. And those things are, wow, relaxation. Since when do we talk about relaxation? And of course, it's very, very important. And again, we'll show the science behind it. Sleeping less. Now, I'm going to be the first to admit, I mean, we're not all perfect in all of these modifiable risk factors, right? So sleeping has definitely caused a change. Look at the amount of people that have reported an average of less than 6 hours of sleep. I mean, it's pretty profound. We're talking about easily over 30% in all the age range groups, right? And the sleep duration recommendations, as you know, change from newborn, to adult. Now, this 6, 7, 8 hours of sleep, it is not a hard and fast rule for everybody. There's a lot of people that practice certain restorative strategies like yoga, meditation. They need a lot less, but this is on average. I mean, these aren't to be literal. And I think that's the problem we sometimes get into in oncology, is that we're so literal that we forget about all the variables that happen. But this is a good a slide for just demonstrating the sleeping issue, right? Sleep deprivation effects on the brain. When you are tired, your cognitive responses are blocked. Your attention reduces, your memory reduces, and your executive functions are reduced. You reduce your ability of all kinds of decision-making activities, creativity, productivity. I think this has been shown in studies involved in residency. I think everyone can relate to this on multiple levels. But do we, in fact, look at this and take this very seriously every time we have a patient in front of us? And then do we have the time? And do we have all these things? So all these questions come up, and we'll get to all those things, right? But this is a nice a slide demonstrating how the cognitive responses overall are impacted by sleep deprivation. Of course, there is something deeper, right? Not needing sleep has always been associated with a bit of arrogance. And I think anyone that's been in the health service track, there's always been sort of a respect given. Like, oh, I only slept 3 hours a day. Wow, that's amazing. But is there a little bit of arrogance associated with that? And I think in the nursing specialty, I've witnessed a lot more empathy to that. And I think that's phenomenal. And I think that we need to continue with that and educate sometimes our structure, if you will, in which we work, how important this is. A lot of people highlight how early they rise, but is it really something to brag about? We talk about the 4 a.m. rises. I mean, it's one thing if you're waking up at 4 a.m. and sleeping at 9 p.m., but this can also weaken our immunity. And I think all of us have witnessed that if we've not slept and got a potential virus. And I think that science is pretty clearly laid out. So in a sense, how can we modify that? This is what I was talking about in the sense that that specific time of sleep is not ubiquitous, right? There are certain people that have a decreased cortisol response, when they practice certain techniques. Transcendental meditation was easiest to show in this specific study, right? Because it's standard. But think about all these restorative strategies that we have. And it's meditative-like in a sense. So this really impacts our relaxation, so how alert we are. So without these techniques, then some of us may need to sleep more. It's really quite that simple, but it's a balance, I think. And this is a very fascinating slide, which actually showed that there was a magnitude of increase in left-sided activity, provided by mindfulness meditation. And that actually predicted the magnitude of antibody titer rise. I mean, that's fascinating, that mindfulness, in a sense, and a lot of us practice mindfulness and we don't know it. So it's not about specific things individually, am I doing it right or wrong, but has a role in the defense and repair process. And remember, the defense and repair process is one of those 7 processes that we see on that functional medicine slide. I think this is fascinating, and I think more research has been done on this, yet how do we execute that, and perhaps a system that doesn't provide a value proposition for it when we try to apply these things to our patients. Functional MRIs, I mean, it is absolutely fascinating. They've done functional MRIs in active meditators demonstrating increased cortical thickness, increased neuronal activity. I do want to just take some time. Meditation was just the easiest to study at that moment. There are a lot of meditative-like activities we do, but to say that that's going to increase your actual functional MRI in the brain, that's relatively profound. And so that's been done. More neuronal connections, more connectivity, usually alertness, energy translates to a better quality of life. And that's really what we're looking for most of the time. Let's get to stress. And, when we say the word stress, we attribute to stress, as Einstein said, make things easy, but not too easy. Stress is multidimensional, and it makes sense sometimes to break it down. We may not have time to break it down for our patients, but at least for ourselves, we can understand this. And so it becomes more personal as we speak about this, right? So what is stress? Stress, broadly speaking, is the loss of equilibrium when one's experiences, when the pressures that are imposed exceeds one's coping resources, right? So this, in a sense, kind of differentiates between good and bad stress, right? Now, if you cannot cope with the pressures induced, you're going to be in a state of quote unquote unhealthy stress. And that's really what we're talking about in general. So stress is multidimensional. We got the physical, diet, exercise, lack of play and laughter, right? That could be a stressor. We got the emotional, inappropriately expressed feelings, but everyone has a pretty good and valuable underlying need, but that's emotional. It leads to wounding. That happens a lot, and we tend to express those emotions in ways that don't benefit us. There's mental, right? Our limiting mental beliefs, how the world should be, how this person is not behaving like this, why that person isn't masked up, and self-talk leads to judgment. Very often, those types of mental feelings don't really serve over the long run, but they could be present for a really long time, especially when we add a crisis such as cancer. Systemic. Think about the cancer experience and how that absolutely uproots the personal, family, social, and work life. Let's look at recent events in the coronavirus, talking about how that completely disrupts the entire flow, the entire process. But we'll show how this disruption can actually be used as an opportunity for growth. And that's really what we're talking about. And the spiritual. We talk about this a lot in general, but we don't really apply it and think it matters sometimes in conventional medicine. We all know that it does. Who am I? What's my purpose? Can I disconnect with my ego? Can I get to something real? And how important would this be for a cancer patient who has gone through this transformational journey? And for now, it's what's next? What to do with this time? And where am I connected within this framework? And I think that when we're going to a state of swasthya, I use this word, it's a word that kind of just indicates balance. So we have a relaxed body, even breath, clear mind, open heart. We're able to kind of sense everything. And, we're able to really induce these energies. And this is where we can kind of come to a place and really start talking with people. And so it becomes very much on an even plane for us. The stress spiral, if you will. I think we can all sort of agree that this is quite very pertinent to how we experience things ourselves. You got pressures and conflicts. Then what happens with that? You can't manage. You slip into performance issues. You worry over the loss of control. Anxiety, disturbed sleep, difficulty concentrating. You cut out your leisure time to make up for this productivity loss. And this word productivity is often bandied about, often by organizations and instructions, and sort of have a little difficulty communicating with staff members based on this. That leads to reactivity, managing the time poorly, leads to fatigue, mood swings, poor decisions. You're suspicious, you're hostile, right? And then finally, you further decline in performance, and the process continues. And that leads to despair, depression, and further illness, if you will, or the state of not being well. So what to do? What do we do with this, given the fact that there's so many pressures that are happening within the clinical context, within this quote unquote work life? How do we then apply it, right? I think first of all, assuming that we all are in the position to begin to discuss this with the individual patient at hand, we broach the topics as they are interested in. We pick one that interests them, right? Otherwise, it becomes a bit didactic. After all of the cancer treatments that I've undergone, I myself had made that mistake initially. I just assumed that everyone felt the need to balance all this stuff, but it's a lot for people to take in. And I think the nursing specialty really sees this at a deeper level. But the nursing specialty really also sees these insights. So why not broach these topics if they're interests, right? So timing is very important when you broach these topics, right? And then we can talk about the yoga, artwork, journaling. Again, Memorial Sloan Kettering has a great evidence-based program on acupuncture, massage therapies. There's the Society of Integrative Oncology guidelines that demonstrate the role of mind-body therapies during breast cancer treatment. Some people really like to stick to only thing that's published. Hey, it's there, it's published. We can highlight its importance. Based on patient-specific factors, we can then look to see where they would like to go with it, right? This is about empowerment. These things that are so personal to our lifestyle, they need to come from a place of within. How often can you say, in the physician specialty, sometimes we say, we should do lifestyle modifiable risk factors. We should mention that. And you put a checkpoint in. You may even do that for billing. But what is the impact on the patient if they're not empowered? That's my question. And of course, we can look at the NCCN guidelines for cancer-related pain. I think a lot of us would be shocked to see what we can find on there. And again, I like to bring up a lot of interesting work being done on cellular healing meditation, how we can heal ourselves, how people respond to it. And that response is very different. And that's very important to take that diversity into account when we're recommending certain things or bringing this up. Because then it gets to, do you agree with this? Do you agree with that or not? And we're moving beyond belief into, does it work for you? This is a quote from the MD Anderson Chair of Breast Oncology. Talks about the routine use of yoga, meditation, and relaxation techniques and passive music therapy has been associated with high levels of evidence. And these activities have a very low level of risk. So why would you not offer them or broach them as a routine part of patient care, especially when symptoms are not well controlled? And this helps some people kind of, now you're talking about symptom management and not cancer therapy, right? So let them think that. So symptom management, let's say that, because at the end of the day, that reflects on the organization. These things, as cancer survivors, cancer thrivers, their word is very, very powerful. And so this helps us communicate with people that may not be able to frame this idea of functional medicine into oncology because they may not recognize the role. But everyone recognizes the role of helping symptoms, right? And if you can help a symptom with low risk, all of a sudden the risk to benefit ratio is magnified. And that's how we win. We magnify that risk to benefit ratio. This is just a study that came out. It was done, and it was basically done in the VA in 1982 on chronic pain patients on the practice of mindfulness meditation. One technique which demonstrated such a decrease in the pain rating index. And that's fascinating to say that we can decrease pain. Obviously we've seen what's happened with the narcotic issue. I think for cancer-related pain, narcotics have a role, but we can see how these things can make the situation worse oftentimes. Now, if you have a practice that someone can engage in that has low risk and this kind of results, maybe it's time to take a look at it. This mindfulness that we talk about actually demonstrated changes in gray matter density, all right? And this gray matter density is involved in learning, memory processes, emotional regulation, perspective taking, and perspective taking is key. I mean, how often do we sit with patients and when they have a powerful perspective, it makes quote unquote the job easier, but then we're able to sort of multiply our impact, right? And that's the most potentially redeeming thing for us inside, and that always translates to the patients, right? And this idea of multitasking in life, I think that's great. There's a great TED Talk on the myth of multitasking. And it says, multitasking, why don't you try monotasking? Well, truly, we can't really multitask well, in that sense, at the same exact moment, right? So that leads to mental fog, scrambled thinking, and this has been shown. And it's also dopamine addiction feedback, right? Rewarding the brain for losing focus and seeking external stimulations, going through the motions, seeing patients in 5 minutes, right? It's impossible for us to actually feel like in 5 minutes we're really able to multitask all of the patient's stressors that are going on in that moment. And I think that that's there. And I'm sure everyone's like, yeah, that's great. I mean, I multitask all the time. I get that. But I think you can understand the perspective that this stress is coming from when we talk about true multitasking at the same time. And how many times are we asked to do things at the same time? Epigenetics. So stress can cause change to the DNA. That is quite fascinating. We're talking about DNA methylation. I think a lot of us know about DNA methylation in the context of certain tumor types. Like imagine your actual genetic code being altered, your precious code being altered by health endpoints and creating them. autoimmune disease, certain cancers, mental disorders, diabetes. So the impact of stress is not just on the mind, but it's on the genetic code. And that's pretty fascinating. I mean, actual methyl group being placed on your DNA. It's sort of impactful to think about the possibilities. The effects of these stress on pain. We know that the cortisol and adrenaline produced by stress actually intensifies pain intensity. I mean, that's truly powerful when we think about inflammation and someone's subjective painful response, and that there's an actual correlation between the two. And so that moves us to the science of psychoneuroimmunology. This is well understood for a long time, this mind-body model. I say these both words because if you use the word psychoneuroimmunology, these powerful words leading to certain thoughts, people are always like, whoa, this is scientific, right? The same thing as mind-body. It's simply stating that at the psychological level, that affects our neurology from the brain also into the gut-brain axis, which everyone knows too, right? We always see the impact between how we're feeling mentally and how that affects our gut. And of course, finally on that immune system. And in this day and age, everyone is so interested in the immune system, how to protect themselves against cancer, but then also how to become a thriver after cancer. And so this is an idea of how we can connect these three levels, and it's been happening for quite some time, and the science has been well shown for 30 to 40 years. Let's get to nutrition in this functional medicine matrix as we try to move through these modifiable personal risk factors. An integrative oncology approach to nutrition and toxin avoidance. Oh boy. So we all have a personal relationship with nutrition and toxin avoidance. And the more I think, the more confused I get. And that's why the picture we have there, right? And it's very important that we don't spend too much time on the details. How often do we have a patient come in and be like, hey, the first thing they want to ask is, should I be taking high dose vitamin D, right? So instead of saying yes or no to that question, it's often helpful to give them a bigger scope just so they can see where their question actually fits in, right? So what do, right? This could be a talk in itself. A lot of the way we were brought up to eat maybe should be reconsidered. This is emotional. Have you ever had potentially a child tell you that they don't like this food that you made? That's an emotional response. Why? Because food is beyond just eating. It's connection. It's purpose, and it's very difficult. They may not want to change this. They probably should. Just kidding. Not really. So this is exactly the thought process we have. Food, again, connection, culture, and enjoyment. We can't be perfect, right? So we need to put value on the role of food in connection, culture, and enjoyment. But then on the flip side, we can also talk about what are the things in our power to do to modify nutrition without altering these other things. So the diet word is a tough one, right? Diet usually comes from cutting. It's like, what's your diet? It's like, okay, what do I need to cut, right? Whoever said diet has to be cutting? I mean, we can focus on addition. When we focus on addition, cutting is a natural process. I mean, we cannot potentially add all these things without cutting something. So easy things to describe, the perimeter diet. It's something very specific you can say in the grocery store. Think about that perimeter. Things in the middle are often processed. And I just say no to processed. It's just not necessary. The cereal industry, the food bar industry, they tricked us for a long time. They told us about unhealthy fats, and all of a sudden, processed carbohydrates became the norm. And that's just the truth. We all know that to be the case. Plant-based diet, right? Plant-based diet is like the Mediterranean diet. When we talk about nuts and grains, and now there's all kinds of grains. And you actually have to show people the way. Show people, step one, go to Trader Joe's. You can buy this quinoa, make it like this, and see how you like and eat it with that. You really have to show people. Telling is not enough because sometimes food involves culture. So how can you take away someone's culture? Plant-based doesn't mean no meat, right? So telling someone to just cut out meat flat out is, again, it's a no. So it's often helpful to rephrase when we talk about, the health benefits of the omega-3 acids that we find in fresh fish. And then I often say, if you're going to eat meat, maybe we should do research and know where it comes from. And that's simple because meat is sometimes a part of someone's culture. But of course, if this is a cancer, let's say, that comes from the gut, then we have to look at potentially the role of, fairly unprocessed red meat in that matter. But it's a balance. So again, I keep that in mind. Food is community, connection, and joy. Taste, We all know about the great fat lie. I mean, we were lied to for a long time. I mean, the American Diabetes Association tried to put the blame on fat when we know, and that's what happened with the whole low fat, non-fat type attitude. We replaced the fats with unprocessed carbohydrates. That is nuts. And I think we're evolving out of rice and corn. So when we talk about rice, corn, these were times when the forager societies, the agricultural societies did not have enough food, right? And so they were constantly foraging for food. And so when you are eating these simple carbohydrates, your glycemic index often rises, and the body's like, all right, where's a marathon? So if we don't have the marathon, what is the role of these simple carbohydrates? There isn't any. That's why we have to move towards complex carbohydrates, that people like. You have to show them the way, and show them the way. Food networks, this and that. You don't know how to make oatmeal? Let me show you. I add blueberries. I do this. I make it with almond milk. These things kind of help, and it really helps people be like, wow, there is another perspective, and they will maybe find their own way. Then we talk about the specifics that people are really interested about, pesticides, etc. We have the list of the dirty dozen and the clean 15. But of course, this isn't an option for everybody. That's why we don't want to overwhelm people. That's why it helps, I think when we span out a little bit, then we can focus down on the details. Plant Medicine 101. And I'm going to bring this up to you. I'm certified as a plant medicine provider here in the state of Florida. What do I mean by that? I refer to cannabis and or medical marijuana. What is the role of this stuff in intractable nausea, pain, low energy, anorexia? This stuff's been going on since 1979. Donald Abrams, the chair of Heme Onc at UCSF, used this, and they said, wow, patients from AIDS are dying. What are they dying from, the virus? No, they were dying from malnutrition. And so literally medical marijuana in that moment saved lives. Cancer patients die a lot from what? The cancer is somehow getting into the heart and stopping the heart? No, we die from malnutrition often. So think about if we can impact nausea, low energy, and anorexia. It's a fascinating response. I'd love to see that randomized trial in patients that are, let's take your lung cancer patients that are curable. Let's take pancreatic cancer, right? This is a whole science. It's well worked out. Cannabinoid receptors, they're G protein coupled. There's two different types of cannabinoid receptors, one in the brain, CB1 and CB2. So and we'll get into potentially the difference between, THC and CBD. They're anti-nociceptive. They work for pain. They work for neuropathic and nociceptive pain. They're antiemetic, and they work particularly well in these nerve type pains. And how often do we have the neuropathy that we just can't do it, and all of a sudden we have something that's very, very, very available, and we just don't know enough about it. So the single agent type thing, just sprinkle some Zofran on it, is not going to last, I don't think, for that long. I just heard right now that Marinol was actually discontinued. I think finally they got the idea that Marinol is just a pharmaceutical version of an effective drug. So do we just sprinkle some on it? Absolutely not. There's a great book called Cannabis Pharmacy, Practical Guide to Medical Marijuana. You can go specifically for cancer if that's what you will. The foreword is written by Andrew Weil, who we may know from the University of Arizona, did a lot of work in integrative medicine. Talks about the difference between the CBD and the THC receptor. For the most part, if we're talking about antiemetic effect, if we're talking about really improving pain, improving appetite and performance, we're really talking about the THC receptor. So you would need to have some sort of access, and that's dependent on the state. The lowest dose to gain an effect. So it's fascinating to me, some of the nurses in our clinic was fascinating, like Dr. Mehta, nobody's high. I'm like, no, they're not. But at that 2.5 milligram level of THC, you get the benefits of eating, energy, a burst of activity without the psychological high. And that's very, very important. And it's very possible. You can look up Donald Abrams' talk from UCSF on the role of medical marijuana in the practice of oncology. And when patients or people shift to cancer, you say, yes, this is the cancer. We're talking about symptom management and how people can thrive. The functional medicine matrix, I think the last one that we have to cover is relationships. And I think this is such a profound statement because these relationships are formed for us as well in the hierarchical structures which we may work in. And how do we balance those things? Same thing when someone has a crisis in oncology. It's not just about the patient. Yes, you do what's best for the patient, but be careful about that. It's about the provider, it's about the patient, and it's about all the people that interact with that patient. Here's another one. This is coming from The Lancet, the growing problem of loneliness. I think this is deep to our heart. We're talking about the 26% increase in risk of premature mortality. And it's really coming down to loneliness. And if you're interested, there's a lot more work done in the Lancet. Loneliness is stigmatized, it's trivialized, it's ignored, it's out of the scope. But my friends, when we're talking about chronic illness, this is what's done in studies with heart disease, right? Neurological conditions. Imagine the impact of loneliness on cancer. And if we did studies on that, we'd probably be surprised to see what we can hear. So relationships are very important. Can't mitigate that. Now, the fun question, this is just for fun reading. Don't think that you have to read it on your own, but how to impact change in behavior? Why aren't they listening? We're often wondering, right? You know who has the biggest problems with that? Physicians have the problems with that. We know what to prescribe, but why doesn't the person change the behavior? They don't do what I tell you to do. It's because we're not trained in that. It's that simple, and this is not critical. It's all about training. How to Change Your Mind. This is a book by Michael Pollan, which talks about potentially the use of psychedelics in changing the perspective of death and addiction. And people that meet death or die before they die often have much better outcomes and are able to eliminate their depression. It's completely counterintuitive. We talk about eliminating cancer rather than channeling the feelings that it has. And this is not about how to use psychedelics per se, but in that you'll find how these things actually affect the mind. Another book by Chris Voss, Never Split the Difference. How do you negotiate with the patient, right? How do you negotiate with them? How do you have empathy, tactical empathy, and then get them to your side by making it their idea? And then finally, Transitions, right, by William Bridges. Everyone is making life transitions. So how can we have a beginning to anything without ending something? So we have to really understand what the patient is willing to come to terms with, put an end to it, because it's really hard to have a beginning. We talk about a beginning a lot, new beginnings, but we forget about what's the ending. I think endings are something we don't like to discuss so much in our conventional approach, but they're very real. Planting the seed. How can we begin to talk about this with somebody, right? First of all, as we mentioned before, let's look at their interest. I made this personal mistake earlier. If they're interested, we have to plant seeds. So if they're willing to take a look at something, potentially healing before you're cured, for instance. This is a book that a friend of mine wrote. He's a radiation oncologist and an actor, and he wrote this on these concepts. Again, there's a lot of books, one by Louis Hay, You Can Heal Your Life, all these sort of things. Gives people something to grasp onto, again, if they are interested. This does not apply to every single population, maybe a lot for people to handle, and we will have to live with that, right? So it does not have to be done on every single patient, but we have to plant a seed before we then see how that's going to sprout. Society of Integrative Oncology, behavioral change is not easy. So how do we can advance the science and the art as much as we want, but behavioral change is not easy. That's why we see the coaching impact. A lot of nurses I know that are going into the coaching field, because guess what? They are great motivators in behavioral change. So why be limited to the scope of clinical medicine only? And that's empowering, I think, for all of us. Patient, what can I take, right? So everyone's like, well, what can I take? Even if it's natural, not natural. So kind of have to reframe that into what can I do? What process can I engage in? How can I change my scope, right? We do not have to do everything we recommend as a physician, right? I mean, or as a nurse provider, as a mid-level practitioner, we can't do everything we recommend all the time. We're not perfect. We have the primary care physicians. We have nursing, radiology, surgical oncology, medical oncologists. And I put radiation oncologists in small letters because I'm very mindful of all these recommendations given by my colleagues. I do not say, hey, do A, B, and C without understanding all these other recommendations they have going on. And so timing is very important. It's important to synergize your opinion with everything that's been told to them. And how do I do that? I pick up the phone and call. I say, listen, I'm trying to do this. This patient can't eat. Would you mind if we put them in the database of medical marijuana? Oh, wow. And then they eat well. Now everyone's happy. So, that's kind of how I like to reframe the context of, hey, what can I take right away? And we kind of reframe it slowly, because otherwise you're going to have conversations on high dose vitamin C and if that's going to work or not. And, we all know how those talks sometimes go. What's the summary that I have to say? Again, Game of Thrones, it is a little bit of a battle in that sense, but I'd like to think of this less of a battle, because we're not fighting ourselves, really. We're not fighting ourselves. We're not fighting at all. We're embracing as an opportunity for growth. So this functional model, I hope to have shown you how this functional model can directly be applied to oncology. There's a plethora of data on symptom management and enhancement. So you shift the focus. If someone says, oh, how does that contribute to my cure? Then you can say, okay, let's talk about symptom management and enhancement. And everyone relates to that. Start with what people like. It's that simple. And their strengths if they don't have it. Garner support from the community. I try to garner support from my our nursing team, but not by values, by virtues, because people have to know that you are going to act on that value. And so when that value is acted upon, it becomes a virtue and people take it in. Another argument is that if you work for an institution, work for a clinic, use it for brand development. I mean, we all know that the field of marketing has, for better and for worse, has advanced in cancer care. We often talk about branding cancer fighters or this new machine, and there's a role in that. But what about this stuff? What about brand development at the level of the patient? And I think that you can, often explain this to, faculty and also the people that are making decisions. Speak your mind. I think at the end of the day, you got to speak your mind at the end of and act upon that mind. So if you cannot get what you can do across in your specific microcosm, maybe that's okay. But maybe you feel like there's something more. When you speak your mind over and over again, using social media, et cetera, and demonstrating what can help, people will come to you. And there's a big article, practitioner burnout coming from Stanford. This was huge. I mean, the hospital was losing money. And guess what? Had nothing to do with people working too hard. It had to do with the values and virtues that were expressed in the institutions in which they were working. That's the source of burnout. And I thought that was fascinating because we talk about HR as human resources. Humans aren't resources. We're actually completely rechargeable. We're not like fossil fuels. We have no end. But how do we recharge them? Is it just about saying, hey, work a little less? Potentially, but there's a lot more that goes into it. Practical integrations and solutions, right? So if you're interested, who are you trying to convince, right? Sometimes we're trying to convince someone and we're hitting a wall and we'll keep hitting that same wall and over again. And then we finally, when there is no wall, we don't jump, right? Because we've been hit over and over again. I'm using the analogy of the dog. It was kind of a sad story. They shocked the dog so many times and they put a big wall and he tried to jump. Then they reduced the wall and the dog wouldn't jump anymore. So what if we're looking the wrong way? What if sometimes, let's say the institution doesn't want to correlate? So what? So there's a lot of other people out there. There's a lot of nonprofits. There's artists, and they would be very interested in this. So we have to educate, be clear with our semantics. We have to start somewhere, right? What are the resources? What are the potential sources of funding? What are the buckets, right? So we have to correlate. We have to generate a sort of team, if you will, to really say, hey, this is a small cause. I know we've donated millions to cancer research, which I'm happy that's happening. But how, if we donated that, let's say there was a bucket of donations that was happening, we put a little bit of that into functional medicine, changing people's lives with, let's say, a 10 course or 10 session, high intensity interval program. When we put the patient in there and all of a sudden that changes them. Look at what we've done. For $200, let's say, for $100, right? We don't have to do all this work ourselves. There are plenty of people that if we can move or connect them to it, they can do that, right? Belief and opinion versus action. Don't worry if someone doesn't agree with you, you act. Beliefs are just beliefs. It doesn't mean that much in a sense, because as practitioners, we're interested in action. And again, let's not try to change the system. Everything needs to change. Fine, I like that, I appreciate it, but change is often associated with stress for ourselves. Let's add. When you add something, change becomes a little bit irrelevant because sometimes an older system, an older thought process then becomes obsolete. And we know this, how social changes happen. We added something and that's how the change happened. It wasn't like you changed it. Kind of a little bit of semantics, but you know what I mean. Something that I'm involved in, and you can feel free to reach out to me. The program's Making Moves Universal, and really wanted to emphasize the benefits of movement in conjunction to music that help patients. And I used to run sessions, and I still run Facebook Live sessions, helping people move. And through those movement sessions, we now create spaces in which now all these questions arise, like purpose, this and that. And we can kind of put people where they want to go. But if we don't take a stand for what we think we want to do, then it becomes very hard for us as practitioners that are interested in it. And not all of us are interested in it. So that's okay too. But if you are interested, please don't ever feel handicapped. Because every move counts. And it doesn't mean you have to dedicate your whole life to this, but you can dedicate part of that time just by connecting people. There's a power in that. And so I run these Facebook Live sessions. You have at the bottom, you have Making Moves Universal, my own personal page, which is at Dr. Raj Moves. Please feel free to friend me. And this is not a promotional thing in any way whatsoever, but since the lockdown happened, I've been doing these sessions on Sundays at 7:30 p.m. We do all kinds of lineup. I have a big interest in international music. My range is very broad. I speak Spanish, Portuguese. I love the oldies. I love everything from country to techno, everything you can possibly imagine. And so it gives an idea, and we're able to start talking about certain these things. And whether or not it's helpful for someone is sort of irrelevant, but it's the fact that you're doing it. And then when you can connect to that individual person and they enjoy it, they feel that, wow, there is a sort of a light out there, aside from just getting the treatment. And just getting the treatment is very important. So I'm not in any means, I'm a radiation oncologist. It's important for people to finish, but how much better would it be for people to get through therapy when they're able to sort of balance all those other things we've been talking about that are important in the functional medicine process. So let's make a move. Finally, I'd like to end with this quote. I think it's a great quote when we're trying to do something. It's not really the critic that counts, nor the man that points out how this guy stumbled, or whether the doer of the deeds could have done them better, but it really belongs to the person that's in the arena. Of course, it was written a long time ago. Let's say the credit belongs to the woman who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who makes mistakes, who comes short again and again, because there isn't any effort without error and shortcoming. And we have to understand that. We have to miss 10 times before we can get that win. But who does actually strive to do the deeds, who knows great enthusiasm, devotion, and spends herself in a worthy cause? And at best, we know the end, the triumph of high achievement. At worst, at least you dare greatly. And so this place is never going to be with the sort of the timid souls who neither know victory nor defeat. And you can think of it as that kind of a challenge. You can think of it as, maybe potentially the management is not there. So what? You're the one that's trying. Feel free to message me, reach out to me. Here's my email address. You can reach out to me through a phone number. I can connect you a little bit more to what we're doing. And I think when we work together outside of a given scope, then we don't see limitations. We just see possibilities. And people are out there, suggestions, criticisms. If you want more data, if you want more references, if you want other resources, collaboration. I've certainly learned a lot through this journey. I've been humbled a lot by this journey. I've made certain mistakes, but typically it all has to do with what the other point of view of the other person is. Even if someone feels like they're negative in a sense, those are people to learn from. So when someone tells you something, we're all looking for positive thinking, and I think that's great. But if we see something negative, we got to put that into our bank and be like, all right, how can we grow and learn from this? And I think that's the most important thing. And I know I have personally, and mostly it's because of the nursing specialty who has been able to sort of support the vision, but also understands how things are in clinical practice and where the value proposition of things lie. Thank you very much for your attention. It's been a privilege and honor. And again, the most important thing is feel free to message me with any sort of things you would like clarified. It's a privilege and honor. Thank you so much to AONN for inviting me. And I hope this was a pleasant experience. Now feel free to get out of your chair and move around. I'll do the same as well. Thanks a lot. Have a great day.